Stakeholders in public health. So what is a stakeholder? And there's a variety of definitions. So a stakeholder is any member of society who may have an interest, which is a stake, in a specific policy or an issue. And it could be a person or an organization that has a legitimate interest in a project or an entity that would be affected by a particular action or policy. Or it could be someone who has just something to gain or lose based on the outcomes of the planning process, the program, or the project. So ask yourself, what is a legitimate interest? How do you decide? For this course, we're going to use the third definition of stakeholders. And anytime we discuss stakeholders, that means that it's a person who has something to gain or lose throughout the outcomes of the planning process, program, and project. So each of you are stakeholders, including myself, the population, different organizations that both work with and serve the population, as well as who the population interacts with. So who are the stakeholders? There are many different stakeholders within an organization or community and groups. Stakeholders can be broken down into the public and private sector, voluntary and community sector, and the general public at large. So what are some examples of stakeholders, or how might they be involved? Well, if we're trying to develop some sort of alcohol reduction, maybe quitting binge drinking within a community or population, we might engage the public sector by reaching out to the local police or even working within the local schools. In the voluntary sector, we might reach out to Alcoholics Anonymous or youth groups or even Mothers Against Drunk Driving or MAD to work with our projects or provide insight or feedback. And in the general public, we might just reach out to kind of your local residents to see what their thoughts are about alcohol reduction or what ideas they have or what problems they cause within society. And within the private sector, this is kind of like your businesses and individual funding. So you might work with different bars or restaurants or even liquor stores to figure out what their thoughts are or how they can be involved in reducing binge drinking or alcohol abuse within a population. So really, it's engaging these people that might have some sort of vested interest. One way or the other, they're going to be affected by your project or by whatever you're trying to achieve in the public health sector. And you want to involve them so that way you have that full, robust view of what's going on and having all the resources available to you to make sure that you achieve what you say that you're going to with your project. Since we'll be dealing with the public, it's important to understand the public sector. That is public health. So you need to know and understand the levels of government. So as a little refresher, if you wanted to go back through government and remind yourself of that course that you had to take way back when, there's a link provided in the slides. For the CHES exam and the National Board of Dental Hygiene exam, you need to make sure that you're able to identify different governmental organizations by their acronyms and the level which they serve. So you have these different levels. You have the federal level, which is the entire country as a whole. That's the federal national level of government. And then governments are broken down based on the state of which the people they serve. So you might have the state of Indiana has a government, Illinois as well. And then that's further broken down, as you can see from this slide, into the county, maybe the city, or even a township. It really kind of depends on that more local level. So be able to identify these. Understanding the government public health structure is vital if you're wanting to get into this field, and even as a member of society. So you need to be able to walk yourself through this diagram and understand who's in charge of what services and at what level of government. Non-governmental organizations, often referred to as NGOs, play a key role in public health, especially at the community level. Non-governmental agencies serve many different purposes, from advocacy or education to emergency relief and economic development. General types of non-governmental organizations include professional membership organizations such as the American Public Health Organization, organizations that focus on a specific health problem such as the American Cancer Society, different citizens groups such as Americans for Non-Smokers' Rights, and foundations that support health projects and work on the policy level, such as CARE, which fights global poverty, and the Bill and Melinda Gates Foundation, which fights public health projects around the world. It's important that we really think outside of the box and really acknowledge all the different organizations that are stakeholders within our projects. So this includes the media, employers and businesses. Where do you work? Are they willing to help you? Those governmental agencies we talked about, and academia, which is what we're doing right here, right? It's our education, training, and research and public service. So increasingly, social media serves as a vehicle for the public's discourse on public health concerns. And historically, public health agencies and other partners have educated the public and promoted healthy behaviors through the news and entertainment media. But we're also now seeing social media providing public health education. And you think of how many times you've seen information about the COVID pandemic, or how to mask up, or ways to be safe or be healthy through the social media platforms. Employers and businesses contribute to the public's health by providing health insurance. Workplaces also have wellness initiatives such as gym subsidies that promote the health of their employees. And even some agencies bring in different health providers so that way they know that their employees can be healthier. As well as they provide funding, such as Walmart, who donates money to local communities for different community outreach projects. Governmental agencies such as the CDC works in partnership with the state, local, and tribal health communities. However, important contributions are made by other governmental agencies at all levels, and you have to keep that in the back of your mind, including city planning departments can include sidewalks and bike paths to promote and support safe ways to exercise. Educational departments might include public health messages for their students, implement prevention and school health programs such as vision screenings or immunizations right in school. And they might work to ensure healthy food options are available at school. I know Lincoln has a healthy school, so I can't send cupcakes with him for his birthday. Similarly, many other governmental agencies can work as partners in public health by including healthy considerations in their public policies. And then, of course, like I said, academia, what we're doing here. So we educate and train the public health workforce, but we also are doing research, and you guys are out creating public health problems. So there's many different ways that we are stakeholders, and different levels of stakeholders can be involved. So really, the limit to this is your imagination. So what do we mean by involvement of stakeholders? So what do we mean by involvement? So engagement. Engagement is where you, as a program planner, you might reach out and engage the population. You might work with them one-on-one, and they may provide some sort of insight into your project or understanding more of that population. Consultation is where you, as the program planner, may reach out to very key stakeholders or key informants and ask them for their opinions or thoughts. So maybe you have a draft plan and you want to know whether it's going to work. Or maybe you have a general idea about a health problem and you want to know more. So you might consult some stakeholders to get some more insight. And then participation. Participation is where they actually show up to your project as well as they helped plan. There's different levels of participation. So think of it more like that hands-on type of experience. So once we know how the stakeholders are going to interact or engage within the project, there's different levels of involvement. So that stakeholders can take in public health and community program planning. The lines between each one of these levels are kind of blurred, so sometimes it's difficult to recognize or categorize one into one specific level. But as we progress through the different levels towards that highest level of participation, the stakeholders are moving to be more and more involved in the project and more hands-on. So what do each of these mean? Well, give information. That means that the stakeholders actually come to you because they want to give you some sort of information. They might say, oh, we want to tell you something that needs to change, or here's the current process, or what we want for you to do is X, Y, and Z. You could get information from that population, which is where you seek the information from the population. So you reach out to them and say, hey, I need to know more about X, Y, or Z. And you'll actually do this with surveys for your population. The forum for debate may be where you provide the opportunity for your population or stakeholders, which your population is a stakeholder, to discuss an issue with you. And so that way you can come to an understanding from one another's perspective of exactly what's going on so you can be better prepared. And then finally, there's that participation. So participation is where we let the stakeholders, they're going to work directly with you on the project. So maybe you might just be working with them to engage them and empower them so they can take care of their health or provide nutritious foods. You could also work with them to plan a project, maybe change a neighborhood, maybe enable them to be able to put together a fitness program. I don't know. There's so much that you can do. So as you move up these different levels of involvement, you're getting more and more hands-on participation with your population and other stakeholders within your project. So you might ask yourself, why do stakeholders want to be involved in the first place? Well, each might have their own reasons for participating, but most importantly, involvement allows us to create a program that identifies and addresses a true need. The more stakeholder participation in our projects results in a better supported program throughout the community for both participation, where people actually show up, resources, so that way you can afford to do what you want to do, and overall outcomes of actually improving their health. So in summary, the field of public health is broad and interdisciplinary. So beyond the government, it requires stakeholders on multiple levels with different amounts of engagement and skills to be involved in different intervention programs, the development of policies, research, evaluation of programs in existing systems, and education. Also, that way we can improve the health and ensure the conditions for population health on the far end. So some key takeaways from this video include that a stakeholder is a person who has something to gain or lose through the outcomes of the planning process, program, or project, who have an interest or a stake in that specific policy or issue. 2, there are many levels to the public sector, including federal, state, and local governmental agencies, and you need to be able to identify where each governmental organization falls. Non-governmental agencies, such as volunteer organizations, are important as well to public health. Stakeholders can be involved in many ways, including engagement, consultation, and participation within the project. Involvement is based on the information or participation seen from those stakeholders. So how much and how far into hands-on do you want them to be? And 6, there's many reasons why a stakeholder might want to be involved, and understanding why they're involved helps you to capitalize on that relationship to ensure that you meet the outcomes that you're trying to achieve.